Make sure you stay till the end of this video, because at the end of this video, I'm going to be giving away to 30 lucky winners something super exciting valued at over $400. And I've never done a giveaway this big before. In honor of 30K, we are giving away something that's going to help you reduce anxiety, optimize gut health, and prevent reflux to 30 people. So be sure to stay till the end so you can enter to win. Hey friends, what's up and welcome back to my channel. I am so glad you're joining us today for this acid reflux Q&A. I have some amazing questions from my last video that you guys commented, and I'm going to be answering your questions on acid reflux, gut health, LPR, GERD. And if you're new here, my name is Molly. I'm a registered dietitian. I specialize in acid reflux and GERD, and I'm here to help you overcome your symptoms, take back control of your health, and enjoy your favorite foods again. So I personally struggled with GERD for years. I know how devastating and anxiety-provoking symptoms of throat pain, heartburn, mucus production, pain underneath the rib cage. The symptom list goes on and on. It's a terrible disease, and I suffered with GERD for years. I have a full video on my story here about how I overcame acid reflux, but essentially I used a holistic approach, really combining personalized nutrition, strategic supplementation, alginate therapy, nervous system support to help myself overcome GERD, and I've been able to help hundreds of clients in our private practice, FLORA Nutrition. All right, so our first question is, hey Molly, I have LPR, which is laryngopharyngeal reflux. It is also known as silent reflux. It's the symptoms of reflux in your throat and in your mucus production, voice changes, basically reflux without heartburn, and can impact the respiratory system in the throat as well. This person says, my doctor told me to do a diet without protein, so no chicken, milk, and yogurt because of the pepsin. What do you think about it? So I actually disagree with this recommendation. I definitely think you should still consume protein foods because your body is still going to be producing most likely some stomach acid and some pepsin when you're eating, and you want to give your stomach acid and your pepsin something to work on. Also, a diet without protein is most likely going to result in some muscle wasting and might result in some unplanned weight loss. So this isn't an effective long-term approach or even an effective short-term approach that we use in our practice. We work with a lot of people with laryngopharyngeal reflux. And what we really need to do is first and foremost prevent the reflux. So we might use alginate therapy. My favorite alginate is called Reflux Raft. It's linked down below. But I've never eliminated protein completely, and I haven't had to do this for any of our clients to see symptom relief. We do eliminate often the acidic foods. If someone is struggling with LPR, there may need to be a period of restriction with the acidic foods. So things like vinegar, lemon, soda, caffeine, citrus, fruit, or even sometimes acidic fruit like kiwi might be enough to activate pepsin in the throat, and you may need to pause that for a little while. There's a whole lot of information about what to eat and what not to eat for reflux in my acid reflux playlist, so be sure to check that out as well. Okay, next question. Hi Molly, I am 20 years old from India. I'm suffering from acid reflux, but I can't afford your fees. Do you have a free course? I actually have so many free resources in my link tree. I will put that down below. We have a free meal plan. We have a free grocery list. Tons of free webinars as well, so you can learn so much, as well as the acid reflux playlist here. There's so much there. And then we also have the FLORA app, which is $22 a month. So that is a more affordable option to get support. You can ask questions on the app. You can get all the recipes, meal plans. You can go through the reflux relief modules. There's basically a course there in the FLORA app as well. So you don't have to get the whole 8-week masterclass, which is a little bit more expensive. We do have the FLORA app for a more affordable option. Next question. Was food moving back up to your throat one of your reflux symptoms? Yes. So this is called regurgitation, and this can be due to multiple factors. It could be due to a relaxation of the sphincter. This could be due to overeating, lots of things, as well as increased gastric pressure or slow gastric emptying. So this was a symptom of mine, and it's a symptom we see very frequently in our practice when people come to us. Okay, next question. Why do I have acid reflux no matter what I eat, or if I don't eat, I have it all the time? So this is a really great question, and if you have reflux after every single thing you eat, or if you have it all the time, this is a big indicator to me that your root cause of symptoms right now might not be food. So the food might not be causing your symptoms if it's happening regardless of what you eat. This might be happening to underlying gut imbalance, maybe an H. pylori overgrowth, or maybe you have a lot of inflammation in your throat and your esophagus.
that could also be contributing to that. And so a lot of people forget when they're treating reflux, you can't just focus on stopping reflux. You also have to focus on reducing inflammation, because inflammation could be why you're still having pain all the time. There's damage there, there's irritation. So we have to stop the reflux and soothe that. Next question, if you have to take a PPI or an H2 blocker, do you recommend one over the other? Really good question. So I am not a medical doctor, so I don't dispense medications. We really focus on a holistic approach in treating reflux. But what I will say is many doctors who are really well known in the acid reflux space, such as Dr. Jamie Kaufman, she wrote the Dropping Acid book. She is really a pioneer in the reflux space. She feels that Pepcid is a safer long-term approach because it has less side effects. Pepcid is less of an acid suppressant than PPIs, so it might be a better approach for some. And those with LPR, laryngopharyngeal reflux, research has shown that famotidine, Pepcid, can be more effective than PPIs for some. So definitely take a look at that research as well for yourself. And I will put that paper down below for you so you can take a look at the analysis between alginate therapy, which again is that algae barrier that we use a lot in our practice. Reflux Raft, link down below. You can look at how that compares to PPIs and Pepcid for those with laryngopharyngeal reflux. Next question, how long did it take you to start reintroducing trigger foods back into your diet, and when do you know it's the right time to do that? Really good question. It took me a long time, but I had a lot of trial and error. So I was doing this all on my own. I was trying every supplement, every diet. I went to tons of different specialists, and it was a whole waste of time and money because nobody really specialized in reflux. So if I could give you any piece of advice, it's don't waste your money on a provider that doesn't specialize in reflux. You need someone who understands reflux really well, and I wish I had that. It took me a long time. It probably took me about a year to really reduce my symptoms to where I could introduce coffee back in. And I think I knew because my symptoms were just really stable. Like my symptoms were at a 0 or a 1 out of a 10, 10 being the worst. And they were stable, and if I did have a little bit of reflux, I knew why. I knew it was because I had 2 glasses or 3 glasses of wine. I knew it was because I had an Italian dinner too late at night or something like that. So that's when I knew I could start kind of like pushing the boundary, was when I really didn't have symptoms, and if I did, I knew why. So that's really our goal with our clients. Our goal is for us to bring your symptoms down to a 1 or a 0 for about a couple weeks, and then we can start slowly reintroducing things in a really systematic way to take the anxiety out of it and to give you the tools to understand what are your threshold amounts. Threshold amounts being how much of the trigger food can you have without symptoms. All right. In one of your videos, you said removing the reflux triggers is not an effective long-term approach. Can you elaborate on that? Yeah. So I believe that removing every single reflux trigger completely, like no garlic, no lemon, no vinegar, forever, is not sustainable for a lot of people. Some people it might be sustainable, and if it is for you and that works for you, that's awesome. But a lot of our clients come to us and they want to be able to have some flexibility to dine out, or some flexibility to have, vinegar or chocolate in small amounts. And so our goal is to understand the root cause of your symptoms. There's usually multiple root causes at play, but so that we can address those, so we can actually prevent the reflux, heal the tissue, and then you can have some trigger foods in moderation. So I've definitely seen the super restrictive reflux diets backfire in a way. I've seen a lot of binge eating or food anxiety or unintended weight loss come from super restrictive diets. So our goal is to help you reintroduce those foods and be able to enjoy them. It's not that it won't work for reflux prevention, but usually long term, it doesn't work well to completely eliminate everything. It's not sustainable for a lot of people. This brings me to one question we also had, which was, if I book a one-to-one session, do we go over testing to determine the root cause? So when you book a one-on-one session with us, we have you upload all of your previous medical tests if you have them. If you have an endoscopy, if you have a barium swallow, a pH impedance, we look through everything so we can understand what root causes may be at play. We may also advise you on like, hey, we think you would be a really good candidate for an endoscopy, or let's talk to your GI doctor about getting a pH impedance test, or let's talk to your ENT about a barium swallow. I think that'd be a good next step. So that's definitely something we do in that one-on-one session. If you're having other GI issues like bloating, constipation, bowel irregularities, abdominal pain, we might talk about a SIBO breath test or a GI map stool test. The GI map stool test is a really comprehensive gut microbiome test that we use with our clients to assess for H. pylori, to assess for potential digestive enzyme insufficiency, and then overgrowths or potentially not enough healthy bacteria. So much information can be gathered from the GI map. So that is a really helpful tool and something we also will recommend if applicable for you. I will drop the link to learn more about that in our one-on-one sessions down below where you can apply. Okay, next question. Do you still sleep with a wedge pillow after your recovery? Is this a lifetime thing? So I do not sleep with a wedge, but I do prefer to have a couple pillows stacked. I definitely still like to sleep like slightly elevated, but I don't have a wedge. This isn't something that I think is a lifetime thing for everyone. Some people, it may be. If you have a larger size hernia or a lower esophageal sphincter issue, you may need to sleep elevated. It might work better for you to do that, but everyone is different. The Medcline pillow has a really nice sleeping system that can be more comfortable. It's a wedge pillow that you can kind of slide your arm under. Or the Reflux Guard under the mattress sleep system is great because it's just under the mattress. You don't really even know it's there, so that's a good one too. I'll link them down below. Next question, is there a video where you explain how to actually find the root cause of your reflux? So this would be probably a 2-hour, 3-hour video if I went into every single thing that could possibly be causing your reflux and how to find it. But I do have a video on the root causes of reflux. So definitely check this out. This is the most common root causes that we see in our practice, but there are so many from H. pylori overgrowth, SIBO, hormonal imbalance, gallbladder issues, hiatal hernia, lower esophageal sphincter issues, chronic stress, nervous system dysregulation, poor digestive enzyme function, slow motility. There's so many root causes. So we do talk a lot about that in the 8-week masterclass. There's a whole module on just finding the root cause. So I'll put the link for the masterclass down below, but I do have a YouTube video on that as well. Next question, is there anything to do with poor esophageal motility? So if your esophagus is not contracting properly, this is also known as poor esophageal motility. If your esophagus is not really moving things down well, or if things feel like they're getting stuck, or if it's seen on a esophageal motility test that the contractility is not working, this is usually due to reflux. There's other root causes too, but if you have reflux, this is often due to prolonged reflux. This can be challenging, but there are some treatment options from a nutrition standpoint and from a medical standpoint as well. The key is really preventing from getting to this point. We really want to prevent you from getting to the point where the reflux has impacted your esophageal motility. But if it already has, number one is stopping the reflux. So using alginate therapy, again, Reflux Raft is linked down below. Using other lifestyle strategies to prevent the reflux, everything we talk about in my videos. Avoiding the reflux triggers, giving your esophagus time to heal, and reducing inflammation. So preventing the reflux will help reduce inflammation, but you may also need to use like mucilaginous herbs like slippery elm. From a medical perspective, sometimes they'll use Botox injections. It does depend on the person, depends on the motility issue. Sometimes Botox is used, sometimes a prokinetic is used. So you can talk to your doctor about that. Next question, I've been working on lifestyle nutrition, which has been very helpful, and I'm trying to address the root cause of stress. Awesome job. I would now like to wean off PPIs. What do I need to consider? So I would make sure your symptoms are baseline controlled, and I would get the okay from your doctor that this is safe for you to do, because you always want to talk to your doctor before changing medication. But I would really do this in a nice, slow, gradual manner. So when I was weaning off PPIs, I really took my time. I would think I was taking like 40 milligrams of omeprazole in the morning and at night, and so I slowly decreased. I went to 20 milligrams in the morning and night, and then I went to 10 milligrams in the morning and night. Omeprazole, you can actually get a 10 milligram, which makes the wean a little bit easier. And then I would just drop down to 1. It took me a few months to do this, but I really went gradually because you really want to prevent that acid rebound effect where you're having a ton of acid production, and that can happen if you wean off too quickly. So you want to do this nice and gradual. And I would utilize an alginate like Reflux Raft probably during this process too.
Okay, you guys, thank you so much for joining me for this Q&A. I'm thrilled to announce our 30K giveaway. We are giving away to 30 lucky winners a lifetime free FLORA app membership. So if you're not familiar with the FLORA app yet, FLORA is our app that helps you prevent reflux, optimize gut health, reduce anxiety with reflux relief modules, step-by-step programming, also reflux-friendly meditations, yoga, tons of recipes and meal plans, everything you need to support your gut health and prevent reflux. In order to enter to win, be sure to like this video, subscribe to my channel, and drop a heart emoji and your email down below. Again, that's like the video, subscribe, and drop a heart emoji and your email in a comment down below, and you will be entered to win a free lifetime FLORA app membership. Thank you again for being a part of this community. I couldn't be more grateful that you're here, and I will see you in the next video.